Thank you very much for all your time. And so first of all, my name is Varagunan, Varagunan Mahadevan. I'm a family doctor working in Canada, and I also do palliative care specialist, and also I'm an assistant professor in McMaster University teaching family medicine's residents and medical students. This webinar, this is our fourth in the series. We did medicine first, healthcare. Second, we did the education. 2 weeks ago, we did the agriculture. And this is going to be the career guidance, which is a very, very important topic and very important thing for the betterment of our motherland, Lanka. So thank you very much again. That's a little introduction. Yoga Varadan, I want to introduce few people here. Yoga Varadan is the man behind, the brain behind this, I can say. He's in Norway. He's my good friend and classmate. He's the CEO. He's an engineer, basically. He's the CEO of Rosevilla Heritage Home in Udeville. That's a new concept brewing in Jaffna. Yoga Varadan will be able to tell us more about that, but it's a wonderful, I visited their place. It's a gated community. They're building houses, and it's a good future plan in Rosevilla, Udeville. That's Yoga Varadan. And I also want to thank Niranjan. Many of you might have known Niranjan. He's a very popular guy. I don't know why he's still not joined politics. He will be, without any doubt, he'll be elected. So Niranjan is the man behind the Jaffna Managers Forum, which is doing like enormous service. And he's the man behind lots of good activities in Jaffna. I've been known him for so long. Thank you very much, both Yoga Varadan and Niranjan. Without further delay, Yoga Varadan asked me to quickly present the scenario in healthcare sector. Most of my quick talk will be around Canada and some in Sri Lanka. I also grew up in India for 18 years, and Canada, I'm here past 20 years. Before we start, I would actually kindly request all the speakers to, stick to the time. I know it's I've been given a very, bad task to maintain the time. So we have actually fixed time as 5 minutes for everyone. So 5 minutes, you will be hearing a noise. I have a timer in my hand. I know if I sound very rude, please excuse me. I've been given the difficult task of maintaining the time. So 5 minutes, there'll be a siren, and you may want to prolong a little bit, 2 or 3 minutes. Then we can stop it. Hope everybody is on board with me. So thank you very much for doing that. So let me start. I'm going to start the timer now for myself. So if we see our Sri Lankan culture, it's not only Sri Lankan culture, we say, even in Canada, Norway, England, and UK, I mean USA, we have these 4 or 5 professions, we say, the prestigious ones. So if somebody asks, hey, what are you going to be when you grow up? I mean, I told everyone I'm going to be an engine driver, the railway engineer. That was my dream when I was a child. Somehow I went into medicine. But the prestigious thing any child or any parent would have is being a doctor, engineer, lawyer. The next thing will be accountant. I'm not saying in the right order, but the doctor, engineer, lawyer, accountant, and a banker. These are the 5 cream things we see in our society. Not only in Sri Lanka, everywhere. But I quote Mahatma Gandhi here. Mahatma Gandhi's version is called, he coined that word, dignity of labor. I realized it when I moved to Canada because I have to do my certification exams. I didn't want to just sit and wait at home and study. I took up a job as a security guard, and I realized how much that dignity is given in Western countries like Canada for a security guard. Then I also worked as a personal support worker with very much dignity. There is no difference. I didn't find any difference between a security guard and a doctor or a personal support worker. But that is what lacking, I think, I may be wrong, please correct me, in Sri Lanka, that dignity of labor. So we're not going to go deep into that. In the field of medicine, yeah, can I suggest everybody to self-mute yourself, because there is a problem here. If I mute everyone, there is going to be, so kindly mute your microphones, and you can unmute it when your turn comes. So in the medical field, we know the doctor and the nurses. I am a visiting lecturer in Jaffna Teaching Hospital. I do lectures for medical students and nurses. Whenever I go to the nursing station, the nursing school, there is still, there is this notion of the nurses are assistant to the doctors. There is still, I know things are changing well, but nursing is a separate profession from the doctors. Nurses are not assistant to the doctors. I'm sure everybody agrees with that, and we cannot ask our nurse in the hospital to bring me a cup of tea. Yeah, you can ask in a friendly manner, but you cannot order it. Or, hey, can you get me the towel? I saw this in the Jaffna Teaching Hospital. I'm not trying to change the culture here, but I'm just saying what I saw. So nursing is a profession by itself. So among nursing, there are different levels. So there is called registered nurse. They have a bachelor's degree in nursing or a master's degree in nursing. And there comes the RPN, that is registered practical nurse. That is one level down from the nursing, but it is not inferior or superior. Please excuse me if I sound like that. Then you come the personal support workers, which are, they have become the heroes during this COVID-19 pandemic, because they are the folks who are near the patient. They are like mothers, so bathing the patient, cleaning them. So these are the levels of nursing. Then we have the clinical professions and the non-clinical professions. So I was talking about the clinical professions, the doctors. Even the doctors, there are specialists, there are surgeons, there is some other cultural thing. Like if you're a specialist, they sometimes ask me, hey, what are you? I say, I'm a GP, I'm a family physician. And say, oh, you're just a GP, huh? Okay, yeah, I'm just a GP. That's still there. I don't care, because that dignity of labor again. And you get all these surgical folks, a neurosurgeon gets a huge respect in society. Then like a guy doing a postmortem, like a pathologist. So there are, in the society, there's a cultural thing in society. Oh, you're just a GP? Yes. So clinical side, there's a doctor, there is nurses, and there is, I mean, I'm sure you guys know, the physiotherapists are an important part of our medical fraternity. The occupational therapist, there are only very few occupational therapists in Sri Lanka that I found. There are social workers there. There's a difference between social workers and psychologists. So there are psychologists and psychiatrists. Psychiatrists are medical doctors. Psychologists are not medical doctors, but they do the psychotherapy and treatment. So that's another, I'm just going random. So the clinical, I'm just muting here. So clinical topics are like this, and among the hospitals, you have other clinical people like the perfusionist. The perfusionists are very important people when there is a surgery like the open heart surgery, or there is a bypass surgery. They have to work with these surgeons and anesthesiologists to maintain the respiration and the heart rate. So perfusionists are there, operating theater assistants. And there is another clinical staff called nurse practitioners, and they are excellent. They are like the GPs, but they have limited scopes. and they have physician assistants there. So I can go on going on the clinical side. On the non-clinical side, there are administrative staffs, there are middle managers, there are IT personnel. Now everything is migrating to electronic medical system. So you need a huge team of professionals, networking professionals, computer experts, software professionals. These are great avenues for the next generation to choose. So what's happened is, when our time, I don't know, even now, when I say our time, that is like 18th century, it was like you have to be a doctor. You have to study for A-level and you have to get high marks. If you can't get high marks, you're depressed because you are not going to the university. You can't do anything after that. Oh, in university தம்பி போயில அப்ப செகண்ட் செய்யடும் போய் யாழ்ப்பாணத்துல tuition ஏடும். So there was lots of pressure, but now there is a big understanding of what's happening. With one more quick comment, I'm going to end my talk. Here in Canada and the Western countries, the hospital managers are not doctors. They try their very best to avoid the doctors being the CEO of the hospital. The hospital where I am attached, the CEO is an MBA. He has done a special MBA on hospital management, because they said, hey doctors, you do your work whichever good to you, like you're a surgeon. We don't want you to pull here and waste that training. What's happening in some of the developing countries are, a great surgeon will be the dean of a medical school, and then he'll be in administration, and then he'll be the superintendent of this hospital and CEO of the hospital. He'll be doing administration work, which he may or may not be good. Now his turf is the operating room. So here in Canada and the US, I think even in UK, there are non-medical people who are the superintendents and CEO of the hospitals. With that note, there is good avenues in the medical professions. You don't need to be a doctor to be in the medical profession. That's my message today. I think my timer is up. So once again, I request everyone to kindly self-mute yourself until you get your turn.